You only have about 37% of patients that will reach full remission by trying their first antidepressants. They try a second antidepressant, that number goes down to the 30s. If you try a third antidepressant, you're down to 17% chance of reaching remission. Once you get to the fourth or higher, it's 7% chance or lower. And most of the time when the antidepressant trial happens, it's not a quick thing. It takes time to do an adequate trial. So patients will get started on the starting dose. They'll get worked up to the next dose, worked up to the next dose. That may take 3 to 6 months to have an adequate trial. So when you have patients who have 4 trials, they've likely been suffering with depression well over a year. We also know that depression changes the brain. So the longer that you're depressed, the less active the brain becomes. And we can see this in neuroimaging. So that old story of, you have a chemical imbalance is only partially true. This is where ketamine comes into play. And it's very, very different from all of the other antidepressants. What it does is it helps regulate the firing of the nerve cells. So when 2 nerve cells talk, they don't actually touch. They release a neurochemical or neurotransmitter. The second cell receives that neurotransmitter, and then the second cell fires. But there are also support nerve cells called interneurons that support those 2 cells. And they will regulate how aggressively they fire, or it may stop them from firing altogether. So interneurons really put the brakes on the cells and keep them from talking to each other. So what ketamine does is blocks that receptors, and it removes the brakes, allowing the nerve cells to fire more effectively. So a secondary effect, those nerve cells have the potential to regrow those connections. Okay, and that's what we want. So we're increasing connectivity, we're increasing excitation of the cells, and this happens quickly, right? So instead of waiting 4 to 6 weeks to see results, a lot of patients may see results in 24 hours.